Hello everyone, welcome to Dr. Kim's Dental Radiology. From today's example, I want to demonstrate the importance of proper patient positioning. Here we're seeing two panoramic radiographs. One at the top was the initial radiograph that was taken, and then after repositioning the patient, the second radiograph was taken here, as shown here. Clearly, from these two examples, the second radiographic image is a much better image than the first one for many reasons. Primarily, there's a lot of overlap of the cervical spine with the rami of the mandible, as you can see, whereas we have the separation or clear visualization of the rami bilaterally, and we see very little of cervical spine here toward the edge of the image. Also, the maxillary arch is better visualized on the second radiograph, whereas it's really hard to visualize any radiographic evidence for maxillary arch. Anyway, so you can all agree with me that this is a better radiograph. So the question is, how was the patient positioned when to create this image, right? So overall assessment is that the mesiodistal dimension of the overall the facial structures are much more compressed, and then the cervical spine has made into the image quite a bit. So this would tell you, or what do you think this tells you? So there are three primary ways to for malpositioning. First of all, the patient can be either too far forward or retruded, such that the directional change in the AP, anterior-posterior direction, or the patient could be could have a chin tilt up or low, right? So chin is tilted up such that the eyes are looking into the ceiling or looking down to the bottom of the floor. Or another way is a rotation of the head, right? So the patient head could be rotated, and you could also have a combination of all three or a combination of two, right? So knowing what we know, what would be most responsible for making this drastic difference? If you have said that this is an error in the anterior posterior direction, you are absolutely correct. This patient is biting too far forward within the machine or relative to the focal trough, and I assume that that's likely due to the fact that patient is edentulous. So here you can see part of the bite block, perhaps maybe the cotton roll was used, but without that notch, and the patient obviously is missing the teeth, it's hard to gauge, right, how far the patient is forward or not, especially when you don't have the incisors to bite into that notch, or in this case, even if the canine laser guideline is no use because the canine is missing. So that's why this patient was biting too far forward, and you bring the patient back a little bit, and now you have a much better image. So that was the main point of this exercise or this radiographic example. I hope you found something useful or learned something useful, and I'll see you in the next video. Thank you.